the response to the coronavirus has made it clear that there are lots of things that are the responsibility of individuals. Things like staying home if you're sick, frankly, staying home if you're more likely than others to be sick, practicing the kinds of hygiene our mothers taught us we should follow all along. Personally, I may have set a new personal record for just washing my hands in the last 2 weeks. I've never been adverse to washing my hands, but I don't know that I've ever washed them half a dozen times a day or more before. But those kinds of things are left up to us. And then there are things that are left up to the local level, things to determine in a local community whether things should be open or not, what kind of activities should be the activities where you draw the line in terms of crowds, much likely to be better decided at a local level by even a state, or more likely by a mayor or a county executive than by somebody here in Washington. And then at the national level, we're moving toward our third package now in the last few days to try to deal with this. The first package was about $8 billion, really focused at the immediate health response, supplies, developing a vaccine, trying to figure out what the right therapies were, understanding the things we needed to do to further help hospitals get ready and to further encourage people to go places other than hospitals when that worked. All of those things were part of that first package. And the package that we sent to the president, that the president signed last night, about $100 billion by almost any standard, a huge amount of money to put together in just a short period of time. That $100 billion was, while it continued to work on the healthcare side, also was very focused on just keeping people on a payroll if they're on a payroll. That $100 billion focused to a great extent on how you keep people who have decided they needed to be quarantined or who were in quarantine by a doctor or by a business that in fact was quarantined because it was closed up, keeping those people on that payroll, continuing to keep that part of our economy going. And now today we move to the third package, which is $1 trillion, $8 billion, $100 billion, now $1 trillion. That $1 trillion designed to continue to do all the other things that I've talked about, but also designed to keep this economy at a point where when we get through this, we'll be as nearly to where we would have been otherwise as at all possible. You know, interestingly, Mr. President, here we're going into a situation where we're trying to protect an economy that didn't have any systemic problems with it. It was an economy that was, by all measures, unbelievably good, and then suddenly people are encouraged, sometimes required, to back away from that economy, to cease participating in lots of that economy, partly because we've encouraged part of that economy to cease being part of the active economy, and what do we do there? So this is going to be a different kind of response, more focused in many cases where in the past people said, we need more of your money. Many of the questions, well, you just need to have an access to more money that we can easily pay back when we get through this. We're willing to have securitized loans. We're willing to have lots of things, figuring out how to deal with that liquidity issue. And then there are some things we need to put in this package that simply the government is going to have to look at in ways we haven't looked at before. I want to spend a few minutes talking about one of those things today, which is just frankly securing our medical supply chain. In the past, the idea that we'd worry about the supply chain would not have been at the top of the list of the things that the American people would be thinking needed to be on the first list they needed to look at when they think about public health. But what we see happening now is a direct reminder that medical supplies we use can come from all over the world, and in a pandemic, everybody in the world may think they need what you think you would have received and expected to get more than they think they should send it to you. We depend on manufacturers in other countries. Approximately 40% of the finished drugs and 80% of the active pharmaceutical agreements are manufactured overseas, primarily in China and India. The ongoing global coronavirus outbreak has really highlighted for the first time in today's supply chain what happens if you might not be able to get what you need when you need it. There's also a spotlight on our supply chain challenges generally, and I think as a result of this, we're going to look at that sooner than we would have. But right now in this bill, I'm hoping we include an immediate look, because we have quickly gone through a series of warning signs now that make us understand why we need to look at this and look at it now. On February the 27th, the Food and Drug Administration announced the first coronavirus-related drug shortage, February 27th. On March the 10th, the FDA halted its routine overseas inspections of drugs and devices. Last week, state health departments and the Center for Disease Control and Prevention raised concern about the looming shortage of coronavirus extraction kit reagents needed to actually conduct the diagnostic test, not to mention some concerns about the swab you might need in some cases to take just the normal flu exam. It's more and more clear that protecting our nation's medical supply chain is both a priority for public health and for national security. Obviously, the supply chain has become more and more global. Now, economic efficiency makes sense. Being more competitive makes sense. It's fine to buy things from other countries, but it's better if you have multiple options. It's better if you have other options, including domestic production. It's especially true when it comes to vital options like medical devices, medical supplies, pharmaceuticals, products we need for public health and safety. Now, we see now that this is a problem, and it's a problem that's sort of come upon us in this pandemic environment in a way that we had not thought we'd have to deal with it before, but we do have to deal with it, and we're hoping in this bill, this is one of the places we can deal with it. You know, in our supply chain generally, if you're making something, Mr. President, and it takes 300 parts, and you have 299 of them, you're in really good shape, except you can't make what you hope to make because you don't have that one essential 300th part. If you're relying on factories in China or South Korea or some other place that have shut down temporarily, suddenly your factory has become too dependent on a partner that's no longer there. So a bipartisan group of senators, including myself and Senator Alexander and Senator Durbin and Senator Murray, have written legislation to figure out how to assess our vulnerability in the global supply chain for medical supplies. We want the National Academy of Sciences, Medicine, and Engineering to look at this issue and to look at it now, to look at this issue and determine how dependent we have really become on supplies from other countries, and then to make recommendations as to what some of our options might be. We'd also like to hear their views on how we can make our supply chain more resilient for critical drugs and equipment, what kind of backup plan we need to always be thinking about if our frontline plan may continue to be that other partner in another country. What's our quick go-to backup, and how essential is it that we have that backup? That would include asking how we can encourage domestic manufacturers of some things to be able to step up and reorient what they do when they need it and in a crisis. The president does, to some extent, addressed this idea yesterday by talking about a defense manufacturing strategy. That defense manufacturing strategy may need to be more robust in some areas, just simply because whether it's component parts to a medical device or pharmaceutical ingredients, or simply the gloves and masks and swab sticks and things that you need for basic health care when you're trying to determine what your health care environment is and then deal with it, are out there, and we need to look at it. One example may be the daily dependence on the daily protective equipment that our healthcare providers have. We're interested to know what we need to do and what we need to do over the next 60, 90 days, what we need to do over the next 2 or 3 years. But what we're going to be asking this commission to look at is, we want them to look at it quickly. This is a priority. It has become an immediate priority. We need to know, as we now look at another one of these in a series of epidemics where this has been a concern, whether it's Ebola or swine flu or bird flu or Zika or SARS. We have had too many of these in too short a period of time. And at that same period of time, the globalization of the supply chain has dramatically changed. So as we prepare for future hazards, we want to assure that the supply chain's in place to allow us to provide the kind of health care we need, the kind of response we need, the kind of protection we need. This should be part of the bill we send to the president, hopefully between now and no later than the end of next week. It's one of the things that will begin to set us on a better direction and create greater security, greater health security, as we look at our other security concerns.